Good morning. I'm going to give a quick tutorial on how to document a straightforward case in Surginet Anesthesia. When you log into your application and you uh, press on the select patient icon, this window will pop up. Select your patient by double-clicking on the name, and then this window will pop up to confirm that that is indeed the patient that you want. Click the green check mark, and in this domain that I'm currently in, it's not the live domain, it's a domain called build. It takes a long time for this process to happen. It won't be this long in the live domain. It's much quicker. Also, in this domain and not in the live domain, this window pops up to associate devices. You will not have to do that. It does it automatically in the rooms. So that when you select your case, in reality, this is the screen. It'll look very similar to this when you selected a patient. So the first thing you want to do is select a macro, and there are 5 default macros. These are templates for what you're going to be doing for anesthesia care: general endotracheal, general via LMA, general via face mask, a general anesthetic converting to nasal prongs or nasal cannula sedation. We do that in GI lab, and then monitored anesthesia care. There are also some specialty macros that you can select if you're doing ENT. We have a couple of different ones in there, ortho, etc. So when you have the chance, take some time to look at all the different macros that we have. But in this case, we're going to be doing a general endotracheal anesthetic. So you select that macro, and then this is the point at which you can leave the screen set up in the operating room and then go get your patient from the pre-op holding area. When you come back into the room, what you need to do are 2 things, and then you can ignore the computer until you're ready to start documenting. The 2 things are, you want to set all times to current for this macro. So you click on that, and then click on execute. And at this point, you can now induce your patient, get your line started, intubate the patient, etc., etc. And then when you finally have the opportunity to come back and document anesthesia care, when it's a quiet enough time during the case, that's your opportunity to do so. Okay, so we're going to assume that all those things have happened now and we're ready to start documenting. This is a to-do list, this window pane up here, and the window pane down here represents an action window pane. And you can make one or the other bigger by sliding this up or down. There are actions, which are basically events that occur during an anesthetic case. Personnel is where you can drag your name or the attending's name into the timeline. Medications is the default action window pane. That's where medications can be selected. Intakes is the same thing as fluids or crystalloids, colloids, blood products. And then outputs, only 3 of them: urine, blood, and other. So we're going to come up here to the to-do list, and the goal of documenting a case in Surginet Anesthesia is to get through your to-do list. In fact, you cannot finalize a case until that to-do list has been completely emptied. And all the elements in here are set up in a typical chronological order, so it should make sense as you're going through the case. The first one is the anesthesia start attestation. And just drag this action down to the time at which it happened. This green A represents the anesthesia start time. If you hover over anything down here, it'll tell you exactly what it is that's been populated into the record. Okay, and then this right here is the attending start attestation, saying that the attending was present for induction. And then for each of these, almost all of the rest of these, you will have to edit them and then drag them into location on the timeline down below. So the first one is the induction. And we'll say the patient underwent a mask induction with the parent present. The patient was cooperative. It was easy bag valve mask ventilation, and no airway was used. I come down here, I click OK, and then I drag that down to when that happened, and I know the induction happened right after we came in the room there. The next thing we did was we started a peripheral IV. I edit that and I check the appropriate boxes, self-explanatory. I'm going to click OK and then drag that down to when that happened. Next up is the lactated ringers, the fluid that we're going to be administering. You take that fluid and you just drag it right down on top of when that IV was started. And you'll notice that even though I drug it down here, it populates up here. All the fluids go in this part of the record here, and you'll see in just a second the medications go at the top of the record. So let's say we gave 1 milligram per lidocaine, and you notice that these are all pre-populated. They have pre-populated doses, weight-based doses, that correspond with the weight that's already been entered in for you. So let's say that we actually gave 50 milligrams to this patient of lidocaine. Click OK, and then we drag it to where we want that to be administered. We'll say that was right when we started the IV, and you'll see, as I said, it populates up here. Another feature you can choose to do is just to simply execute. Whenever you execute anything, that's these green arrows right here, it puts it to the timestamp of now, which, I'm going to move this out of the way for a second. This yellow line always represents the timestamp of now. And you'll see the anesthesia record gradually moves in a leftward direction. So I could just pop that over. 120 milligrams of propofol was given. Timestamp of now is 1444. Again, I come down here to the fentanyl, same thing. So just to show you how the double arrow works versus the editing, drag and dropping, either one of those are fine for populating your record. The next icon up here in the to-do list is the red X, and that is there to delete anything that you're not using. So if we didn't use rocuronium, we would delete it. Same thing with dexamethasone. Next up is the endotracheal intubation action, and again, it's self-explanatory. I won't go through the whole each element of it, but I will come down here to this line right here. We want to know in every single intubation, was it difficult or not? If you click yes, it asks you to fill out some difficult intubation documentation that's also contained within the application, but most importantly, it creates a new problem for the patient that then flags this patient or labels this patient as having a difficult intubation, and it goes on the patient's summary page. Okay, so very important stuff there. And then just drag that down to when it was that you intubated the patient. We'll say that we intubated the patient about a minute ago. All right, so I'm just going to blast through some of this stuff that's very self-explanatory. The next thing up that is worthy of comment is reminders. We have a couple of reminders here. Reminders do not go into the patient's record. That is, they don't get printed out. They're just, the whole reason why they're there is to remind you of something, and you can just feel free to delete them after you've addressed it. So in this circumstance, it's about the antibiotic. Most often we give cefazolin. It may be another antibiotic, but if you're not giving antibiotics for the case, you just red X, delete both it and the cefazolin. If, on the other hand, you're going to be giving that cefazolin, one thing that is very clever that people have done is added 3 hours to this time. So in this case, it would be 1746. Click execute, and now 3 hours in the future, there's a reminder floating that will come across right down in this area here in about 3 hours' time, serving as a reminder for you to redose your antibiotics. ECG ventilation. That's the ECG interpretation. What we'll do here is document normal sinus rhythm. It's a pull down. And what happens at this point forward, you got to make sure you're on major timelines. Every 5 minutes is a major timeline because it only displays information every 5 minutes in this area right here on the printed record. So make sure you're on that 5-minute timeline, put that in, and what you'll see is that in 5 minutes, this will say normal sinus rhythm. You don't have to do anything. Of course, if the patient's rhythm changes, you need to reflect those changes. The same treatment occurs with the ventilation mode. You need to document what it is, but once you've documented it once, so spontaneous ventilation at the beginning, it would put spontaneous ventilation for the rest of the record unless you changed it. And of course, with an endotracheal intubation, we often will be on pressure-controlled or volume-controlled ventilation. All right, so that's ECG vent. Anesthesia ready time is self-explanatory, and then the remainder of these medications are medications that you'll give at some point during the rest of the case, which brings you down, once you get to this point right here, that's kind of at the end of the case. And what you'll do is you'll suspend the case. We're assuming now that the case is over. You called your attending back in. This action right here is for the attending to document. You've just extubated the patient, and you're ready to go to the PACU. What you'll do is you'll come up to task, come down to suspend case, If the providers section here had information, which it will, you would uncheck the providers because you want that to continue. And then click OK, and the case will be suspended. Okay, so I'm actually going to put in a personnel. I'm going to put myself in right now, and I'm going to sign the case just for teaching purposes here. Sign the record. You'll have to sign the record also, and you'll have to put your name in. And the way you put your name in is you come down to anesthesia resident. You guys are all trainees, are all yellow heads. So I'm just going to take a trainee from the past, put them there. And then now I'm going to go ahead and suspend the case just to show you what it looks like. Suspend case. Now this is where you need to uncheck providers, because if you don't, it'll stop our times now, and we know that we're going to be continuing billing until anesthesia stop time. So I'm going to uncheck providers. Remember, uncheck both providers, not just you, not just the attending, both providers by clicking on that box. And then, oh, it also wants a fluid amount. So we'll say the patient had 100 mLs of fluid. Click OK. Now the screen will turn white, and you take your patient to the PACU. In the PACU, you give report, and then you finalize your case. And the way you finalize your case is you come here to, oops, I'm sorry, you want to select the case again. And it is not today, it was from yesterday, sorry. You'll find your case, double click on it, open it back up, and then it's wanting to associate to a device. You'll click cancel there. And then this is where all those things get slid into place at the appropriate times. Emergence attestation, what you did for emergence, the transporting of the patient to the PACU, the handoff report that you gave to the nurse, the QI, were there any QI indicators during the case? Click no, of course, yes, if there were any events that happened. And then lastly, the anesthesia stop time. This is now empty, so now you can finalize your case. So we come up here to task, click finalize case. It'll now is okay for the stop times to occur because that is indeed the case. There are a bunch of things that need to get fixed here because I didn't take the time to sign them. This is where those would be addressed, and then once those are addressed, you click finalize, the case finalizes, and you're done. If you have any questions about how to document cases in Surginet anesthesia, please feel free to reach out to me. Thank you.